How do occupational therapists determine what are the best practices for their patients? How do we determine whether the interventions we use are useful? Enter evidence-based practice. Let's jump on into it. Hi, my name is Cam. Hope you have a beautiful day and welcome back to OT and Me. So today I want to talk to you guys about evidence-based practice and what it means for the field of occupational therapy. Evidence-based practice, or EBP as it's referred to in the field, is the concept of taking research results, ideas, and principles and crafting and molding it into effective patient care and clinical decision making. You down with EBP? Yeah, you know me. So evidence-based practice is derived from taking those research results and analyzing them to determine whether or not they're good to use in your practice. Awesome! So evidence-based practice is the intersection between three different points: the best scientific evidence, clinical experience, and the patient's values. So we'll go ahead and start with the first one. Alright, so first, best scientific evidence. There are three different types of evidence, and they are qualitative, quantitative, and then mixed methods. Qualitative refers to descriptive research. This is the use of interviews, the use of surveys, the use of observation. Alternatively, quantitative looks at the numerical data. This focuses on using statistics determining whether something is effective. And then finally you have mixed methods, which is the mixture of both qualitative and quantitative aspects. So being able to get that descriptive aspect but also the numerical and combining the two. Generally speaking, in the academic world, quantitative research tends to take precedent over qualitative research. However, this is not to say that qualitative research does not have value. Let's break it down this way. Qualitative focuses on description, on narrative. It focuses on what the participants are thinking, right? Whereas quantitative focuses on the numbers, on more objectivity. So qualitative, more subjective in the way that it is in the eye of the beholder. It's the focus on the participants and their ideas and their processes and breaking down those themes. And then quantitative, on the other side, is focused on more of the objective data. So what the numbers say, what the numbers determine to be effective. And the mixed methods is kind of the best of both worlds. Again, this is not to state that qualitative is lesser than quantitative. It's just to state that they have their different values. However, in determining the best scientific evidence, we focus more so on using quantitative evidence. And that's where the levels of evidence come from, more of a focus on those quantitative aspects. And so because of that, we're gonna focus a little bit deeper on the quantitative evidence, all right? So over here to the left, we have the levels of evidence. Levels of evidence. Essentially, at the bottom of the pyramid, we have the lowest quality of evidence, and as we move up the pyramid, we have the highest quality of evidence. That is because it's inversely related to the risk of bias, right? So as we start at the bottom of the pyramid, there's a higher risk of bias, whereas if we move further up, there's less of a risk of bias, ultimately making it more objective and quantitative in nature. So as you can see at the bottom, right, you have expert opinion. That's not necessarily very objective in nature. That's very personal to that practitioner. And then, however, if you move up the ladder, right, you have RCTs, or randomized control trials, and systematic reviews of randomized control trials, which are considered to be the golden standard of quantitative evidence. All right, awesome. So generally speaking, as occupational therapy practitioners, we want to be closer to the top of the pyramid. This is not to say that the other levels of evidence are not good. It's just to say that it's always best practice to use the best possible research, obviously closer to the top of the pyramid. All right, so next up in this EBP trio, we have clinical experience. So what is clinical experience? So clinical experience refers to the experience that an OT practitioner has had in the field of occupational therapy. This is one of the more difficult aspects, especially if you are new to the field of occupational therapy or a new practitioner. You might not have too much experience to pull from, right? However, this is very important in use for evidence-based practice in order to draw from those experiences and develop a plan of attack, right? It's also important to note here that prior experience does not necessarily relate to a future experience, right? So this is dependent completely on your patient. Your patient might be a new case, your patient might be a similar case, but has different values on their own. Which leads us to our third part of the trio, and that is patient values. This is such an important aspect of occupational therapy just in general. It's being able to account for what the patient needs, right? What their occupational needs are, what their medical needs are, what it may be that they have for like the wellness needs, what their wellness needs are, right? As occupational therapists, we need to take into account what it is our patients need. We need to factor that into our EBP to make our interventions client-centered, right? As occupational therapy is so client-centered. So yeah, awesome. So how should this be relevant to you? It's important to understand the process of picking and choosing interventions in the field of occupational therapy, right? You need to have that research, right? You need to make sure that your research is solid, that your research is quality. You need to take into account your patient values, making sure that your interventions are client-centered, that they are focused on the individual you're trying to help. But you also need to be able to draw from your own personal experience, right? You need to be able to use good clinical judgment skills and determine whether or not the interventions you are using are gonna be effective and gonna be good and useful for your client, and most importantly, making sure that they're safe. In closing, evidence-based practice is a way for occupational therapists to effectively care for our patients. It helps us to determine what intervention and methods would be most effective and most beneficial for our patients. Ultimately, it allows us to care for our patients in the best way possible. That is EBP. Yeah, you know me. I hope you continue to have a beautiful day. Wishing you wellness through occupation, and take care, y'all.